Sure.
So Dr. Rudd and I met last week with Tina Lane, our Assistant Superintendent for Personnel and Student Services. And we started to take a look at the CDC guidance, as well as a bunch of other resources. Prior to that, Tina and I had met with Jefferson County Public Health and some of the other superintendents in the community. But we really wanted Dr. Rudd as our medical director to weigh in on some of the things that was in the guidance. So we outlined, starting with masks, and we want to walk through this kind of together.
Sure.
What your thoughts and feelings are.
Sure.
On each one. So the CDC guidance recommendation was that students and staff, whether they were vaccinated or not, should universally be required to wear a mask at all times when indoors, except when eating. And then again, allowing for some mask breaks. But then when students are outside, masks could be optional. So I just wanted you to weigh in on that so our board could hear your perspectives as our medical director.
Yeah, I think it's important that we work to continue to kind of control the spread of droplets as best we can within the school setting. It's not a straightforward, simple decision, right? There are a lot of things that go into it, but an important thing that I think for us to recognize is that a good chunk of the school community cannot be vaccinated yet. Like anybody under 12, it just doesn't have that option available. Then when we look at that above there may be a bunch of kids who are or are not for different reasons. And I think we need to get to a point down the road when everyone has that option where we say, okay, and now we need to take a step back and people have made their choice and we kind of go with that. But at this point in time, that's not where we are. And so trying to determine who's vaccinated, who's not, who should have a mask on, who shouldn't, doesn't need a mask on at this point in time, makes that very, very difficult. So at this point, my recommendation would be to stick strictly with CDC guidance. I think that's, the most defensible position, and to go with that at this point in time. Other questions on that?
What's your thoughts about if kids are in a classroom, for example, and they're staying in their seats, being the distance that they are, if they take their mask off, but then they put it on if they're traversing the hallway or if they're, on the bus, that type of thing? Or should you just advocate mask everywhere?
I think as best we can, we should try to keep them masked, particularly those who are not vaccinated. And there are a couple of reasons why. That having been said, I think we need to be rational as well. So like if it's not possible, if the kid needs a mask break, if they're in their classroom sitting down and that's okay, then that's fine. But the reasons that we're talking, I'd like them to keep them on, have to do with what we're going to get down to later, which is some of the contact tracing. So as long as everyone involved where there's a potential exposure has their mask on, the children don't necessarily have to be excluded from school. They need to be tested. But if we're in a situation where the kids are even saying a cohort like a classroom, they're routinely around each other without masks on in the classroom, and then in the hallways, that's going to cause a good portion of that classroom to be then have to be quarantined for a while. If we can avoid that, we might be able to keep the kids in the educational environment longer. And that's why I think it's best, as much as we can, to keep the mask during the day. Okay.
Any other questions on that one before we move on? There is one thing that I would like to note, that sometimes we have a student with a special need, that there's a reason why they can't wear a mask. And when that happens, they have a request that they fill out through the office of the assistant superintendent. And then Tina, which is all goes through, and Dr. Rudd has to look at those, and then he is the decision maker on whether or not. And that actually happened in the past year and a half.
Yeah, do that. Yeah. And if that's like, this all has to be done in a rational, in a reasonable context. Like there are some kids who just are not, some students who are not going to be able to wear a mask. That might be something their therapist and occupational therapists could work with them on at some point or whatever. And so under those circumstances, then we have to kind of bubble that individual and make sure that all the people interact with them, the staff members are strictly masking. That's the only reasonable thing we can do. One
other thing to note too is that in the conversation that we had with Dr. Rudd, you said something very interesting that I picked up on, that because we were all wearing masks last year, the flu was almost non-existent.
Yeah.
And I think that's a point that it's well worth bringing up to other people.
Yeah, so I mean, it certainly, the measures we're taking to protect coronavirus infections are effectively reducing other communicable diseases as well. Like that may not be what we're doing, but it does matter, so.
Dr. Road, I have a question in regards to that.
Sure.
We have concerns about a year from now because we have been having children wear masks for 2 years, what that can ultimately do to their immunity system 2 years from now. Is that a concern because we're kind of holding those immunities in and not having them go about that into maybe next fall if we're not wearing masks, but that's going to be a huge problem with absenteeism and down the line?
Maybe, but not too concerned, is the short answer to that. Yeah, I do think that when we get out to interacting more, we're going to have more illness that comes up. The question is, will it be back to the baseline where we were before? And do we just not remember how much of this challenge we've had? Or is there going to be actually more? And there might be more, I don't know. So that is a concern, as a possibility, but I don't think it makes sense to change what we're doing now. I mean, I guess it's a risk benefit, and I think that the risk, while maybe there, is outweighed by the benefit from masking at this point in time.
So, Dr. Rudd, at this point, you feel as though this is the recommendation. If CDC changes the recommendation 6 months from now, that we're going to follow it again in 6 months, and obviously we would readdress it, but.
Correct. That's what I would anticipate. I guess it depends on what it's based on, but they are, although sometimes there recently has been a little more politics involved. CDC is pretty scientifically driven. And so if there is a reason for them to change their recommendation, I assume that there has been a change in the science or in the community, in the population. And so I would typically recommend sticking with the CDC, guidance. I mean, I think I'm a great guy, but I do not have the resources of the CDC available. And so I like to really rely on their decision making.
Because really, in this case, wasn't it New York State saying follow the CDC guidelines and then we're following that?
Yeah, I think that is also the case. I think New York State DOH kind of deferred to the CDC, which was slightly different than what happened last year. The DOH had their own pretty robust guidelines that they promulgated first. But at this point in time, that is generally been what's happened.
And then the New York State Education Department just came forward and suggested that schools follow the recommendations of the CDC as well.
So 6 months or 2 months or whatever, I think if the CDC guidance changes, it probably merits a further discussion. But who knows when that will be, right?
Right, and we also have to keep in mind that we are having a new governor starting next week, and there's already some, some messages being kind of just out in the public, not, right on the news and such, that there may be a mandatory, masking requirement in schools anyway. So even though we're having this conversation tonight, it's strictly a conversation, because we have to, just like we did last year, things will change. Sometimes they change overnight and we wake up the next morning and we will monitor that plan, but know that we will always seek out our medical director with that guidance, and then we'll make the best plan moving forward for our students. Any other questions on masks before we move on? So the next item was physical distancing, and where possible, this physical distancing of 3 feet will be maintained between students regardless of their vaccination status, and 6 feet should be maintained between students and staff, or between a staff member to another staff member, regardless of their vaccination status. I'll work my way down through these, but stop me along the way if you have any questions. Transportation, students are going to be required to wear masks when riding the bus, and as long as weather permits, buses will be lowered a couple of inches to improve air circulation. Again, these were recommendations of the CDC, and we will do those when possible. Notice the difference, though, in the CDC guidance now versus last year. Last year, you could only have students from the same household in the same seat. That is no longer, that's not restricted. So you technically could have 2 to 3 students in a seat, which would allow us to get all of our students to school. However, even with the mask on, because they're under that 6 feet, if one student tests positive, then the other students in that seat will be quarantined as well. So we will do our best to keep students and the same families in those seats, but know that that's not going to be, an option on all of our buses.
Okay, to go
Yes.
back one,
Sure.
you mentioned last time that there was probably some schools that 3 foot's not possible. What's the plan there? I think North was one maybe.
Yep, so Stacy has been working with the principal and looking at classroom sizes and then moving some of the students with, larger number of students to those bigger classrooms. And I think you've worked that out.
Awesome.
Yep. Which is great.
Yeah.
Very good.
Just a quick comment on that too, because I think that there's some confusion where 6 feet, 3 feet, where did these come from? And so they are actually rationally derived, although it doesn't make as much sense sometimes when you try to process it through. We've usually used, in the US, we've used 6 feet in hospital or healthcare settings. And so that's where we kind of gravitated to initially last year. Well, I don't know, that's when we've done other studies looking for how far do you have to keep infectious people apart. 6 feet in a hospital is the minimum you want to do for respiratory sort of stuff. So we use that, and it's probably rational to continue to use that for adults. Again, that would be an unmasked adult, so that's a little bit different, but an unmasked adult who has a larger volume of air coming out, is speaking perhaps, over a classroom, therefore using a louder voice than you might for a normal conversation. Rapidly, studies have been done around the world, and Europe tended to focus on looking at 1 meter between students in their educational programs. And that's kind of where the 3 feet comes in. So there's pretty good data from Europe that kids kept 1 meter apart, 3.18 inches or feet or whatever it is, we're not seeing substantial increases. And so that's why we're using and able to use that for the students. Also, they're not necessarily speaking over the whole classroom, just talking as loudly, et cetera. So, I don't know if that makes sense or helps you understand why, but that's some of where these differences come from.
The next thing that we talked about were the daily health screenings. And we were sharing with Dr. Rudd that in our last school year, we had during that screening of all of our students prior to school, it didn't result in any identification of any positive cases of COVID-19. And at this time, the CDC is not recommending screenings or questionnaires at this time. So we are not recommending health screenings. However, we are going to ask our parents to continue to do the daily temperature checks, like they would at any given time in any year. If your child is sick or has a fever, we would ask that you wouldn't send your child to school, and that would apply to a staff member. It's kind of going back to the way we've always done business.
Yeah, and when you mentioned that, that surprised me a little bit. So I looked to see whether there was any evidence. I mean, we've been doing this, and there's really not a lot of medical evidence that doing health screenings or taking temperatures at the door makes a difference. Places do it, and I can see the sort of rationale. We're still doing it at the hospital, but again, there's not a lot of actual support that it makes a big difference as far as catching and identifying people. So I actually think that this is rational. I think the message should be, though, like you're saying, it's not that we're not doing health screenings. It's that we're not doing health screenings at the door. We are expecting the parents to use common sense. If your kid is sick, don't send them to school.
And does that mean that there won't be a mandatory check-in on all, or
Yes,
that would be the case?
correct. Yep, no mandatory check-in through parents' care. Now, subject to change, of course, if things change in our community and we find that we're starting to have issues, then we can revisit that.
Okay.
But at this point, I think we're going to be okay to not do that practice. Contact tracing and quarantine was the next thing. And New York State has provided a contact tracer specialist from the New York State Department of Health. She's actually out of Albany. And Tina worked with her recently when we had our positive case over at Wiley. So that's something that's a little bit different for us right now. They assist us with all the contact tracing and quarantining determinations that arise from COVID-19 positive cases related to our school environments. And students who are quarantined and will need to quarantine, they will need to be quarantined for 14 days as per the CDC guidance that came out on August 5th. You want me to jump right into the next one because they kind of go together?
Yeah,
Symptomatic students and testing.
So,
So a student who shows symptoms must either stay home or will be sent home and must remain home until they have proof of a negative test result. If your child's healthcare provider provides a diagnosis of a known chronic condition with unchanged symptoms or a confirmed acute illness, and COVID-19 is not suspected, then a note signed by their healthcare provider explaining the alternate diagnosis is required before your child will be allowed to return to school. They may return to school according to the usual guidelines for that diagnosis, but note, a signed healthcare provider note documenting unconfirmed acute illnesses such as viral upper respiratory illnesses will not suffice. So you might want to jump into that one.
right, so we're trying to just find the right balance, because the current CDC guidance doesn't tell us a lot about, it tells us a symptomatic student should be sent home and evaluated, but it doesn't give us a lot of information about what should the re-entry criteria be. So there are several students who have chronic daily headaches, almost daily headaches. You know, that is a COVID symptom. Do they have to, they have to get a COVID test every day in order to come to school? You know, similarly during the allergy season, many people will have some rhinorrhea or even a little slight change in their sense of smell. So what we're asking is that if this is the case, somebody be evaluated by the physician and had affirmed that this is a chronic condition and that their symptoms are the same as they've been, that there's not a substantial change that would merit further, you know, investigation and evaluation. And if they were sent home for a COVID symptom, we'd like that healthcare provider to either do a test, if appropriate, or to affirm that in their professional decision, a test is not necessary. So we'd like them to put something in writing that they thought about it. And that I think will be adequate one way or the other. It kind of finds the balance between just test them all, you know, and you know, letting the healthcare provider make a decision. Does that make sense to you guys? You have questions about that?
I have a question. If you have a child that has a chronic headache and masks are causing chronic headache, is that, how do you handle situations such as that?
So that becomes difficult, right? And we can kind of try to sort that out a little bit. There may be a scenario, that may be a scenario where we have to work with the classroom teacher to find a way that they could perhaps be slightly farther away and able to take more defined mask breaks, more longer mask breaks and under that situation. But perhaps we work a little more than that 1 meter distance then for that kid. That would be my answer. I'm not shooting from the hip on that, but that's what I would try to do. Does that make sense to you?
Makes sense to me. Okay, so now we're going to get into the fun stuff like the instructional options. And if you read the guidance or you from the CDC or from New York State Ed Department, everyone is really looking forward to a full return of all students in person. And that's the direction we would like to take. We'd like all students to return in person this school year. And we know that this may be somewhat of a difficult decision. All of these decisions are never easy, but the data shows clearly that our students need to receive in-person instruction.
So do you mind if I jump in there
Jump
just for a second? So last year, you know, the pandemic had just started. We knew a little bit more in August or so than we did in March, but actually not a whole lot more as far as what we did. And there were several important reasons to work on limiting families and students getting together, including protection of the students, not knowing how severe this might be for them, and a community protection, a public health perspective as well. Because if these students live in houses with vulnerable elderly, then that could cause a problem as well. At this point, we're not in that scenario. The vulnerable elderly in our community have been vaccinated or at least had every opportunity to be vaccinated. They chose not to, that was their decision, and that's okay. So now we really need to look at what is this doing for the kids. So a bunch of the kids can't be vaccinated. Generally, COVID would be less severe in them as well, although there can be severe side effects for kids. There have been a number of kids who have gotten very ill and died. but not to the same level as the adults do. So now we have to look at what are the social implications of having them apart? What are the, what things do they need to learn as a human being? What are we teaching them? What's the whole educational, impetus about? And I really think it's important to bring them back in. And so it's not just me, I'm trying to explain, but I think the idea of bringing kids back together 5 days a week on a regular basis is really important for their development. And we need to get back to that position. And there's not the same urgent public health need to separate the community as much as we can. I'm not going to say it's impossible, but I think it would be much less likely that our health system and our community will be overwhelmed by even another spike because a good portion of the population is vaccinated, although it's certainly not 100%.
In fact, we also talked about that in our county. We actually ranked up pretty high, at least for the first vaccination, but it was the second one where we dropped a little bit.
Yeah, we have some interesting data in that there's a decent gap between have received one vaccination and series complete. And so you wonder, why did people get one and not the other? And I don't know. Like, it was a much bigger gap than the number of people you'd expect to be naturally in that space. But.
Thank you for sharing that. So in addition to the 5-day weekend person for all students, parents always had the option to homeschool, and their commissioner's regulation 100.10 on home instruction. A lot of that work goes through our assistant superintendent for instruction, Stacy Converse's office. And if that's something that, parents are interested in, last year our numbers almost doubled. Typically we have about 100 students that are homeschooled. Last year we had close to 200. So, and I don't know if the numbers have changed much. In fact, I think some of our homeschool kids are actually coming back this year. A few of them. Yeah. And then obviously there's also another board policy, 8201 for homebound instruction. And that's really for students that are suffering short-term medical illness. And those would all be vetted through, and it's right in the board policy, the medical director. So there are 3 options right there. You come to school. If that's not your option, your preferred option, then you would be homeschooling, or you can look into the homebound instruction, but we will be adhering to the
There are
board policy.
criteria for that. It's not just because you want to.
Thank you. And I appreciate the fact that you vet all of each and every one of those. It's very helpful for our district. As far as instructional information, students in grades 7 through 12, their instructional information would be posted in student Google Classroom, serving as like a repository of assignments for any student who misses class or school. And then for students in grades K through 6, teachers will actually communicate with families of students who miss out due to quarantine or other circumstances. So those things are put in place in the event that you have students really difficult at the high school level and case middle school as well, 7 through 12. If you have particular groups of students that are quarantined, it's very difficult, whereas in a K6, if it's the class and you have the same teacher and all the kids are together all day, things are a little bit easier to compile that work. So that's why there's a little variation there with the assignments and how they're posted. As far as cafeteria, breakfast and lunch and eating, per the CDC guidance, schools should maximize physical distance as much as possible when students are moving through the food service line and while eating. We also are talking about the high level concepts in this conversation tonight. Tomorrow we meet with our administrative team and we will get into the weeds of each one of these things because it will look a little bit differently at each school depending on cafeteria size, number of students that need to come through. So Mary Hughes will be here and Craig, are you in district tomorrow or not? Yep, so they'll be here and they'll be working with our administrative team to work out a plan that's best for each school. And although they will be similar, can't guarantee that they'll be the same. And one thing to note is throughout this process, Mary was just sharing with me the other day, we're starting to see some of the effects of like right now, just even trying to get the food that we need. So Mary, can you give us a couple of those examples with like the apples and a couple of things?
Sure. We're having we're seeing now, after speaking with some of our distributors, we're seeing some massive procurement issues. Chicken, pizza, condiments, For example, we order through government donated foods, applesauce and applesauce cups, and we were supposed to have a bunch coming in on October 1st, and it has been pushed back to February 28th. That's how far out some of this food is going to be. So I said to Patty, you know, that there is a possibility of having some subbed items, but then we can't guarantee availability of the subbed items as well. So we always put on our menus that it's menus subject to change. There will be a lot of changes. We'll notify administration as soon and as quickly as possible. But we'll do everything we can in working with our suppliers on making sure that the kids get fed a well-balanced nutritional meal. But there are going to be massive procurement issues, not only in food, in paper supplies, and we're short on staff. We're down 9 positions right now. We've been able to fill 1. It is going to cause a problem as far as how the cafeteria wants to serve with administration. We may not be able to set up lines in different areas of the school more. They may have to come down through the cafeteria for each of the students to get their meals, just because we do not have the availability of extra staffing to be able to do it like we've always been able to do. We do have some interviews coming up. We're keeping our fingers crossed. But there's going to be some issues in food service. But whether we have issues or not, administration will work together with food service, just like we did last year. And whatever we need to do, we'll get the jobs done, and the kids are going to get fed.
And just like your menus are subject to change, you know, one of the things that you'll read a lot in the guidance is to the extent possible. So that might be our new, you know, going forward. You might see lots of posters to the extent possible, because we will do everything, you know, that we can to the extent possible. But we really appreciate everything that food service has done from day one, back on March 16th of 2020. They have been boots on the ground every single day, working hard. And now you think that we're coming out of it, but it's just important for us all to note that we're still in this pandemic and we're still working through issues that, you know, we thought we would be beyond at this point.
And Patty, I will say that this is not a short-term thing. They're telling us for the next year and a half, the procurement is going to be an issue. So it's not something that's going to just, in 3 months, they'll catch up and we'll be all back to normal again. They're saying at least a year and a half.
And then one of the other topics that we want to just bring forward right now is talking about sports athletics. On June 15th, state officials lifted the COVID-19 restrictions impacting youth and recreational sports, which included interscholastic athletics. And so the season, 2021 fall season, is scheduled to begin Monday. And that per CDC guidelines, if our level of community transmission is at the high transmission, the red level, schools should cancel or hold high risk and extracurricular activities virtually to protect in-person learning. Now that's kind of interesting, because when you think of football being high risk, I'm not sure how you would actually conduct that virtually. So Dr. Rudd and I had a conversation.
I
But
was thinking about that a little bit more from our conversation. So other high risk activities besides athletics, because it said extracurriculars.
Yeah.
So like if we're prepping a musical, you might have a teacher work with a student on the song they're singing over Zoom or Google Meet or something like that is a possibility, because that would singing out would also be another, singing out or shouting would also be higher risk activity. So there may be some rationale, some places where we can do that, although like a little more limited, but you can't really do virtual football. You can't do virtual soccer, like that doesn't work. So, you know, it would probably have to be held.
one of the things that Dr. Rudd recommended, and I shared it with the athletic director, was that in order for our athletes to participate this fall, he highly recommended that we do just a quick health screening, a temperature check, because the kids are sometimes a little bit. And that was very-
Although there's not data, right? And that's the thing, like just trying to find the balance between it. If they're going to be participating in higher risk activities where we're breathing heavily, probably sending droplets farther than just sitting and talking or listening in class. To me, maybe it's just me holding on, I don't know. I just think maybe an extra level of screening and saying, gosh, that kid does have a 1014, like, what are we gonna do with that? That might make sense. So I am asking that we do that for the higher risk activities, just to see if we can, maybe limit it a little bit. But I will acknowledge that there's not a lot of data behind that request still, but it just seems like maybe we should try to do something a little more when we know we're sending students into a higher risk environment.
And I think that the guidance gives us the kind of the leverage to do so, because it talks about layering strategies, right? So you think about all of the things that we did in the last school year that we'll continue to do with sanitizing and hand washing. All of those things that we've done in the past that we know have helped and have worked, we'll continue to add those layers on as well. But I think that, to your point, we can give that a try and see how it goes.
And if we find out that we're wasting a whole lot of time still, we can stop it. But I don't know, it makes sense, a little bit of sense to me to try to do something.
So are they wearing masks for athletics too?
They're not required to wear masks outside unless it's a lot of kids very, very close to each other for long periods of time.
Football.
That's what the guidance has said, but no, it did not say that they
Okay.
have to wear them for football either.
I was thinking that football and soccer, they get kind of.
No, as long as it's not outdoors. If
Okay.
for some reason they're forced to do indoor drills, then they would have to wear masks. But as long as they're doing what they're doing outdoors, I would think that would be safe.
Before I move on, do you have any questions for Dr. Rudd?
Let me just restate, back to the athletic piece at the beginning, you mentioned the criteria for holding or putting off. Can you just clarify that for us?
So it has to do with community level transmission, which is set, basically a data driven thing per DOH and CDC? Is it just CDC?
Yep, and I have the CDC one right here.
It's the CDC is the one I've been looking at recently, but, so right now we're at moderate transmission. There's 4 levels. I can't remember what the lowest one is. And then there's, I think, low, moderate, and high. So at present, we are in the moderate range, as is almost all of moderate, as is much of the rest of the state. There's a good chunk of the state that is actually in high transmission. There's a couple counties, I looked at them earlier today. Wyoming, Clinton, and I think there's one other county that are actually at our, okay, so sorry, it's low, moderate, substantial, and high. So we're at substantial, which is at orange. So we're one below at present still, that level. There's several that are at moderate. There's none in our state that are at low transmission at present. If you're interested, you can actually get right on the CDC site and you can see right where we're at.
How often is that updated? Daily? Weekly?
I think it's daily. If not daily, it's weekly, but I believe it's daily.
I've been checking daily the Jefferson County, and it will tell you the percent positivity and it'll give you which zone you're in.
Mhm.
So it's a daily thing.
So I've been reading some things that have been getting sent to us about testing, and if teachers allow themselves to say whether or not they're vaccinated, then they don't have to be tested. I mean, is there anything that we need to do along those lines?
We didn't really talk too much about that because I noticed today that Onondaga County just required that. It came out earlier today. And that's not something that we've really talked with, because in talking with our legal team that we've been working with over the past year and a half, that was not something that we really have asked of our staff. We haven't not required that. It's kind of a difficult legal issue, with privacy and such, to demand that of somebody.
So will we have to do testing of our teachers because we're not gonna ask that? I guess I'm just wondering, like, what's.
Right now, we're working with the groups in Jefferson and Lewis County, and I can tell you that I have not met a school yet that has made that decision of going forward with that. I do know that Dr. Rudd and I had talked about, if that is a reality, then, North Country Family Health Center can test our students. They cannot test our staff. So if we have a student and, obviously with parent permission, if they needed to have the test, they work all of those details out. So then looking at our staff, how would that work? Dr. Rudd and I talked about maybe something with, Samaritan, but we just never really pursued it too far because we don't know that we're going in that direction.
So I have asked those questions internally, but I don't have answers for you. Like, for example, Samaritan has a drive-through testing site. It's no longer a state-sponsored testing site, but there is still a site there. So I asked the question, if it becomes necessary to do weekly screening testing of all the WCSD unvaccinated employees, is it possible to set that up so that they could say, okay, Tuesday's a day you have to drive through and get your nose fit, and I don't have clear answers for that yet. So I'm not gonna say commit the institution on it, but it seems like there might be a path forward that way if that's something that we needed to do. The question is, would we be able to do the test in-house? Does Samaritan have the resources to do the test in-house on that volume of patients with a 24-hour turnaround time, or would that need to be sent to an outside lab? And so those are all logistical questions, but I think there is a way that this could be done, should that be the way we're going. And for what it's worth, the CDC does suggest that all unvaccinated staff members be tested on at least a weekly basis, just as a screening test. Now, that's one area where I think, because of legal advice, we're varying from the CDC's guidance, but that's out there.
Yeah, and I would even say we haven't really varied yet. We just haven't made that decision quite yet because we're still really investigating. We do know that if you are an employee, if you have our school insurance, that the COVID testing would be covered under that. I checked since our conversation just to make sure that that would be, because if you're forcing somebody to do something, the next question is who's paying for it. So if you have school insurance, it would be paid for under school insurance, but I guess we're not there quite yet. We're still waiting to see how things evolve over the course of the next week or so before we make that decision. Right, any other questions on just the conversations that we're starting on September before I move on to something else? Any questions for Dr. Rudd? Thank you so much for coming in today. I appreciate it. Thank you very much. I'll close that. Thank you. Have a great night. Thank you.